The following ShishMed podcast is a production of drpodcasting.com.
On this edition of the ShishMed podcast, what if you were to take your patient-facing app and use it for your employees as well? Put special content on there and also let them use the patient-facing tools. How cool would that be? Wouldn't that be easy? You have this great app for your patients. Why not repurpose it to use it for your employees as well? That's a good idea. Let's talk to Leah Chatham from Gozio Health about this exact idea, how to use your patient-facing technology for your staff. And can it help with staff retention? I bet it can. Let's get to Leah, right? No. This is the ShishMed podcast, rapid insights for healthcare strategy professionals in planning, business development, marketing, communications, and public relations. I'm your host, Bill Klaproth. In this episode, we talk with Leah Chatham, Vice President of Marketing at Gozio Health, and how to use your patient experience tech to improve staff retention. This episode also brought to you by Gozio Health Partners, with health systems to increase consumer engagement using a proven mobile platform and strategy. For more information, go to goziohealth.com. Leah, welcome to the ShishMed podcast.
Hey, Bill. Thanks so much for having me.
Absolutely. Very interested to talk about how to use patient experience tech to improve staff retention. So let's jump into this. Why should healthcare providers consider using existing patient engagement technology to improve the experience for staff?
Well, it's an interesting thing. I think what we've realized is that there are some similar problems when you're looking at patient experience and staff experience. In both those cases, you often have lots of disparate digital tools that aren't always really easy to access or intuitive, or they're hard to navigate, right? Maybe they've been poorly communicated and people don't know exactly where they are or how to get them, how to use them. And so we often hear from health systems that what they're looking to do is streamline, right? They're looking to streamline the amount of technology they have. They're looking to streamline how people access that technology, whether that's patients or staff. And they're hoping to be able to more effectively use one solution for more things, right? Fewer vendors, fewer technology solutions. Can we squeeze more out of a certain solution to get more out of it, right? And so the way that we've always looked at our platform as a mobile platform is, hey, we can take all those things that are patient facing and put them into this platform, make it very easy for patients to intuitively access all of that in one place. And so we kind of asked ourselves, like, could you do that for staff too? Well, yes, so I think it was just a way of sort of saying, like, yeah, I think you could use some of these same things to get the same better experience, right?
So it sounds like you're kind of repurposing patient-facing applications and just kind of turning them towards the staff. Is that right?
Yeah, to some degree. I mean, it really is sort of saying, well, if we've done it for patients, we can do it for staff. We can take all of their digital tools and put those into a single location too, and make it easy to access from their mobile device.
Absolutely. So the word of the day is streamline. So how would that work then, Leah? Doesn't staff need to log in? So how do you do that?
So I think what's interesting about this use case in particular is we want staff to be able to access all the same stuff patients can access, because often your many thousands of staff in a health system also are your patients, right? There are tools there like wayfinding that are useful for everybody. But yes, there are some things that need to be secured or authenticated into. So the way we've kind of set it up is it's a single app and all the stuff is there. And for the things that do need to be kind of gated, where you need to authenticate in, we can support whatever single sign-on mechanism the organization is using for that. So, that allows you to put all of that staff-facing digital stuff in there. And when they do authenticate, now they're able to see both, right? They can see the things that may be patient facing and open to everybody, as well as now the things that are really specific to them. And every organization is different. So I think one of the things we're learning is you really have to do some discovery with each organization and figure out what tools are they using, how are they authenticating now? How can you make that work? But interestingly, as we've seen often on the patient side, hospitals will generally think they're very unique. Everyone thinks they're very unique. And that's true to some degree, but the underlying stuff that everybody needs is essentially the same. So you may use different vendors and you may even configure some of that differently, but everybody needs, say, an HR tool or, a time off tool when it comes to training tools, when it comes to staff or on the patient side, everybody needs appointment scheduling or provider search, right? Who you use and how you set it up may vary, but a lot of it is the same stuff. So that's kind of what we're seeing is there's some uniqueness in the way you've set it up, but everybody's doing a lot of the same things.
So once the staff logs in, they can also access all of the patient-facing tools then.
Yes. And I think what's so great about that is, well, first of all, obviously, like I said, a lot of your staff are patients too, and they want to be able to schedule appointments and get places. But we have always heard that one of the great features that staff already really liked when one of these our apps is in place is wayfinding and the ability to save your parking spot. Things like that staff use anyway. And we recently heard from one of our newer clients that they had a process in place previously where every new employee sort of shadowed someone for a period of time to learn their way around their complex facility. And that was a huge burden with high turnover and burnout and, lower staffing. And they were struggling to keep that process in place. And when they added the app and the app had the wayfinding piece, they were suddenly able to say to every new employee coming in, you download the app, here's a list of places you need to go, like sort of like a game. Use the app to help you find all these places over the course of the next week.
Wow, that's interesting.
Yeah, they didn't have to pair up an existing staff person and pull that person off of their rotation to train somebody how to get around. So we know that staff were already using some of these tools. So it was good to be able to say, hey, it's one app and you can now use it for both things. You can use the patient-facing stuff, you can use the staff-facing stuff, right? We're just going to try to make as many things as possible easily accessible.
So for the lack of wayfinding or confusion on how to find things, that was causing staff turnover or new employees to say, I'm out. It's too confusing. I can't find my way around this place.
You'd be surprised. I mean, I don't know that I could officially publicly say it's a cause of turnover, but I can say it's a complaint. It is certainly something people struggle with, especially given how many health systems have been growing and merging and adding new buildings, whether they're building onto existing facilities or buying new facilities. I remember last fall being at a conference and somebody saying, he was a provider and his health system had bought a new hospital. And they were sort of moving their staffing around and people were really struggling. People who'd been at one hospital for a long time now being staffed over to another facility they weren't familiar with at all. And it was causing a lot of frustration and burnout, just trying to find their way around in a new facility, but working for the same organization they've been working for years. Yeah, it can be very frustrating.
And that's kind of my point. I could see where that would turn somebody off. I've been in that situation where I've had to go to the doctor at a new place in a major healthcare system. You don't know what parking lot to go to. There's 20 different doors to go in. Once you get in, it's a maze of hallways. What floor? I could see it. Like, and you're going up to how do I find this? Where is this doctor's office?
Yeah.
So I could see where that is a major problem in wayfinding, although it sounds simple, like, you mean you can't find where you're going? But yeah, it can be frustrating.
It can be very complicated. We have clients who have facilities that are several square blocks large. And the ability to be able to say, I just wayfind me to this place and it takes you to the right parking garage and it marks your parking spot. That's something patients and staff, I think, really benefit from. And the other piece of that, and the thing that we see in terms of benefit to staff, even before we ever started looking at putting staff tools into the app, was with prior to COVID, everyone would say to staff, just if you see someone who looks lost or you see someone who looks confused, stop and talk to them and find out where, right? Then COVID comes and everybody wants this very touchless experience. And, you're trying not to sort of interact with people as much and you want people to be able to find their way around. And so there was a real benefit to having wayfinding, and staff could say, here, you can download our app. And there were signs in the facilities and, those kinds of things. Then we saw a huge burnout and turnover in staff. And now it's like, you don't have enough staff to spend that much time walking people around your facility to where they need to go, right? So there's a benefit in terms of sort of taking some staff burden off by making sure everybody has access to those wayfinding tools as well, right? There's just not enough time in the day for the staff to do what they need to do separate from that, right? Yeah.
So true. Well, that totally makes sense to me as one thing that would turn off potential brand new employees. What else about having an app for the staff? How can that also be the answer to any staff retention problems someone might be facing?
We were looking at recent research to try to understand what can impact staff retention. And Qualtrics actually has sort of a worldwide study that they do on staffing and staff experience. And what they found was that in areas where there's a sort of high disengagement, high burnout, high turnover, some of the solutions were pretty simple. Really, what staff had to say was, we sure would like it to be just a little bit easier to access the tools we need at work. We would just like some of the processes to be simpler and more streamlined. There was some feedback that, it'd be nice to have better things like recognitions and rewards. And these are all things, obviously, you can do on mobile, right? Mobile is kind of where people are. Everyone has a mobile device. And we do hear different health systems have different ways of dealing with mobile access. Some allow people to use their own devices. Some have work devices and personal devices, and there's different things. And everybody has to kind of address that. But it's a lot easier than having to go find a laptop and log into stuff, right? And a lot of people are on the go all the time, and there's not necessarily easy access everywhere all the time to laptops and other devices. So I think, what we're seeing is even just that little bit of improvement. Hey, all your stuff is kind of accessible through here. And, as we continue to build that out and sort of grow the functionality, just getting feedback and seeing where can we make additional improvements, what else would be helpful. It's a small change can make a big difference if really all you're looking for is to make things just a little bit easier in healthcare, which is frankly, everything is really hard all the time.
Yeah. So by removing friction to help them perform their job better or access things easier or to be able to save time, that can be really important. So it sounds like you're able then to add staff-only content to the app as well. Is that right?
Yeah. And so I think that's the thing is the ability to have, you already want your staff to download your app and be showing patients how to use it. So having one app that they've already downloaded often is nice because now you're just saying, now you can go here and do your sign on and get your other stuff, your staff specific stuff, and that way you don't have to create another app. You don't have to download more apps. You're just adding to your existing app, which is nice.
So could you put messages from leadership on there? Here's what's happening with our latest capital campaign, or look out, we're going to start construction on a new wing, or this parking lot is down for resurfacing. Can you put those types of news items for the staff on the app?
Yeah, you can do all those things. And that's, I think, one of the nice things. It's funny you bring up the parking piece because you can also close parking lots and close off doors and do other things in the back end of the wayfinding. So people won't be directed there in the first place, but you can do push notifications, you can do banner ads, you can link out to any kind of tool. So everyone hates it when I say this, but it's really only limited by your imagination. When you have a mobile foundational sort of platform like this, you can plug in anything that has an API or that you can link out to. So you can really provide any tool. And at the same time, you can customize it so that you can communicate information very specifically just to staff in the same way you would with patients. You can use the mobile app to do that with patients as well, do banner ads or push notifications or, geofencing, things like that, which actually I think is one of the nice things, the ability to sort of geofence into a specific hospital. So you may be a large health system with multiple hospitals. You can geofence specific tools and communications to a specific location.
Wow, that's pretty impressive. So it sounds like you're doubling the use of the app.
That's our hope. I mean, our hope is that because a lot of organizations are already asking their staff to download their existing mobile app so that they can help support getting that out to patients. It's just one app. You're not asking staff to download another app for them, right? Everybody's on the same one. And that means that you're getting tens or hundreds of thousands of patients on there. You're getting, hopefully thousands of staff on there. Everybody's just on one app and everything is there.
Wow, it really is kind of a no-brainer if you think about it. Leah, thank you for your time. Is there anything else you want to add as we wrap up?
Yeah, I mean, I think I would just say the goal really should be, I think, for health systems who have so much technology and so much going on to try to look for ways to reduce the number of vendors, reduce the amount of technology. And sometimes really just a small impact can make a big difference when you're looking at something like this sort of crisis in staff burnout and staff turnover. The numbers there are huge right now, 25% turnover in healthcare. Can be up to $1 million to replace a single provider. It's costing $3 to $6 million a year for large health systems and nurse turnover. Those numbers are enormous. So just that small extra effort of making things just a little bit simpler, even a little impact, could make a big dent in that, right? In their experience and just improving how they feel about their job, but also when we're looking at that bottom line. So like you said, I think it is a no-brainer because even a small change could have a pretty big effect.
Very well said. And better communication always helps an organization. No matter what you do, who you are, communicating better always helps. So if you're able to communicate better through an app, through the phone, which everybody's got with them all the time,
right?
It just makes sense.
We like to think so, yeah.
For sure. Well, Leah, this has been fascinating talking about the usage of a patient-facing app for the staff. So really interesting stuff. So thank you so much for your time. We really appreciate it.
And thank you so much for having me, Bill.
And once again, that is Leah Chatham, and this episode brought to you by Gozio Health Partners, with health systems to increase consumer engagement using a proven mobile platform and strategy. For more info, go to goziohealth.com. And if you found this podcast helpful, and how could you not, please share it on all of your social channels, and please hit the subscribe or follow button to get every episode. And remember to join us at SHSMD Connections 2023, September 10th through the 12th in Chicago, Illinois. Register at shsmed.org/education/annual conference. This has been a production of Dr. Podcasting. I'm Bill Klaproth. See ya.